Good morning, and welcome to our session on the topic evaluation of infertility. We are glad to have Dr. Ramyasree Reddy with us today to help us understand the topic. The doctor will help us understand the minor details and the importance of the topic. So please stay tuned till the last of the session. The doctor will take up the questions at the last. Please post all your queries, all your doubts on the comment section. We are here to answer all your queries. So, doctor, you have the stage now.
Hello, good morning, everybody. This is Dr. Ramyasree Reddy. I am consultant fertility specialist at Apollo Fertility, Ananagar, Chennai. Welcome to this Facebook live session. Today, we will be discussing an important topic about how, when a couple walks into the OP with complaints of infertility, how are we going to look at it and what are the causes for this? As you all very well know, fertility and infertility related issues these days are a major rising concern. And when we see world over, in all developing countries, as much as one in every four couples are having difficulty to have a child. This can be understood because of multiple factors, which I'll help you learn shortly. So, first, to understand how do we define infertility? When a couple is married for the last 1 year or so and have been trying to have a child and has been having unprotected intercourse regularly and still has not been able to have a pregnancy, that is when we call it infertility and start evaluating it. And there are two types in this where there is primary infertility and secondary infertility. Primary is when they have not conceived since they have ever been married. And secondary is when they have conceived, had an abortion, or maybe had a first child easily. And 3 to 4 years after that, they've started trying for a second child and are having concerns and are not able to have a pregnancy as easily as they had their first one. That is when we call it secondary fertility. So WHO statistics are saying that almost 25% of couples in countries all around the world, developing countries, are having these concerns. When we look at India particularly, AIMS has put out their statistics saying 10 to 15% is the a prevalence of fertility burden in the country. But when you look at a gynec OP, we are seeing as many as one in every five couples having fertility related concerns. So, how do we understand how fertility behaves over various age? So, a couple who is under the age of 35 and have been married for a year, usually around 85% of them have a pregnancy within the first 1 year. That is the reason why we give this 1 year period for us to evaluate them. But if the couple is aged beyond 35, we do not wait for 1 year and start investigating them as soon as possible. So, for us to understand this infertility, first let's understand how a pregnancy happens. What are the various steps involved in it? So, there is a married couple, both good, healthy married couple. They both produce healthy gametes, as in the man produces sperm and the woman produces egg. How are these produced? In a month, a woman is born with a specific number of eggs, and these eggs over her age decline in number and quality. And when she gets her menstrual period this month, that means the eggs which are going to develop in this month have actually been selected in the previous month itself. And they present themselves as small antral follicles in this first 2 3 days of this month's period. And these eventually start growing in size. And around the time of ovulation, one of the follicles starts to become something called the dominant follicle. It grows to a maximum potential and that gets ovulated. This happens around the time of 14 to 15 days in a woman who is regularly menstruating every 28 to 30 days. So when this ovulation happens and women and the husband they have relations at this time, sperm gets deposited in the vagina, and from the vagina, which contains the cervix, which is the opening of the uterus, the sperm travels up into the uterus, and from the uterus goes into both the fallopian tubes. And the egg which is released from the ovary is also picked up by the fallopian tube, and both the sperm and egg meet in the fallopian tube. And when these both meet, they form something called the embryo. This embryo it stays for 2 to 3 days in the fallopian tube, and from there it goes into the uterus and gets deposited there and implanted and then forms a pregnancy, which continues for around 9 months. So, for us to understand what are the checkpoints in this natural pregnancy phenomenon, first is the egg development, wherein multiple eggs which have been selected from the previous month are recruited in this month, and these do not progress to develop a dominant follicle. That means the picture which is expected around day 15 does not happen, and these eggs are all still in the small size even around that time. That means the egg has not developed in its developmental phenomenon. Then, so when that doesn't happen, ovulation doesn't happen. And like we all know, unlike men, women produce only one or maximum two eggs every month, which get released. So this egg getting ovulated at the right time becomes very important for pregnancy to happen. That is the first checkpoint. That is the ovulation problem. Second thing, we discussed that both the sperm and egg meet in the fallopian tube. So when these both need to meet in the fallopian tube, we need to understand that the tube has to be open. It has to be open not just physically, it has to be open functionally, as in it needs to be able to move both the egg from one side and the sperm from the uterine side, both together, to let them meet in the center of the tube. So the patency of the tubes is the second checkpoint. After this, third checkpoint is the uterine cavity itself, wherein there could be some fibroids, there could be some cervical polyps, cervical fibroid, etc., various functional and physical disturbances in the uterine cavity, which will prevent this uterus from getting implanted, from the embryo from getting implanted. Even if the embryo gets implanted, there could be problems of blood supply, etc., for these, which can have difficulty in sustaining a pregnancy. And then the fourth thing that is more important is general hormone status of the lady, like prolactin, thyroid, various health factors like hemoglobin. All these things should be normal to be able to sustain and continue this pregnancy for 9 months. These are the factors that are looked at from the female point of view. While coming to the male point of view, one of the most important things which forms the basic checkpoint here is the semen analysis. That is the sperm that gets deposited in the vagina and is picked up and goes into the fallopian tube for fertilizing the egg. We need to look at this sperm. This is one more checkpoint. So we have understood first checkpoint is at the level of egg development, second checkpoint is at the level of fallopian tubes, third is the uterine cavity itself, fourth one is the general hormone status, and fifth one is the sperm quality. So for us to understand, these all need to be looked into in a systematic manner to understand where exactly lies the problem. So, apart from this, in men, the causes for sperm quality being affected could be multiple. So, when we look at a man, first thing that we would want to know is the age. What is the person's age? And what is the kind of work profile he is involved in? Does he go into a field job wherein he works for long standing hours, or does he put in some chemical exposure? Is there? Or are there any chances of him getting multiple injuries, things like this? They form an important part of us understanding what is his work profile. Then, uh, apart from this, we would like to elicit some details in the history of understanding the male partner's lifestyle, wherein we try to find out whether he has had any childhood infections, any surgeries, something like a hernia surgery, etc., or any uh, at birth, were there any problems with the location of the testis and underwent surgery to get them positioned into the scrotum, or is there any chromosomal problems or any diabetes, hypertension history, and more importantly, whether the male partner has habits like smoking and alcohol, which are very important. Then, in the female, the history that we detail the elicit is about the age, first thing, and after age comes to understanding about the menstrual history. How regular are her periods? When was her last period? And is she having any problem in the amount of flow, etc.? So, why would we want to understand about the menstrual history? That is like what we have just discussed. Every month, a certain number of eggs get selected, and one of them ovulates around mid cycle. And this is how it happens in a 30-day cycle. So, if you know a woman is getting her periods regularly, at least you have to a certain extent ruled out the chances that she has some ovulatory disorder. That is the first checkpoint which we have initially discussed about. Then, next important thing is to understand how are their intercourse and their relations. whether they are aware about which period is fertile, around which time, if they have intercourse, are the maximum chances of getting a pregnancy. This is a very small piece of information, but very important. And many young couples are not very aware about this. And simple corrections as to installing knowledge about when is the fertile period helps a lot of people conceive also. Then it's also important for us to understand whether they have been in the habit of taking any contraception. Some people would have taken OC pills and all for a few months continuously, and then we need to understand that after that, for return of ovulation, it takes some time. And then general health problems like diabetes, hypertension, thyroid disorders, these things also have a bearing. And it's also important these days to know whether the woman is also in the habit of consumption of alcohol or cigarette smoking. Then next important thing that has a bearing is about any previous fertility treatment that they have taken. If they have previously had any IUIs, IVFs, etc., and in spite of that are not being able to conceive. Then after getting a good amount of history and we have understood that we have explained these are the various factors at which levels at which checkpoints are there, we go to the most important step of examination and understanding how their general health is. Coming to the female partner, good breast examination, height, weight, BMI, waist circumference, looking at features of hyperandrogenism, we call that is coarse facial hair growth, or any features of insulin resistance where people have acanthosis nigricans, that is dark pigmentation on their groin folds, on the neck folds, in the axilla, etc. After understanding the basic examination, then there would be a brief gynecological examination, which involves perspiculum and pervaginal examination apart from the per abdomen. Then a basic understanding would be by doing a transvaginal ultrasound, specifically a 3D ultrasound. Here we look at the uterus, the cervix, then we look at the if there are any fibroids or if there's any other uterine pathology, we would want to look at it. And then seeing the ovaries, how are the follicles that are appearing. If more so, if the period scan is if the scan is being done on period second day or third day, that would be the best time to calculate the number of antral follicle count. And when we look at the ovaries, it's also important to understand if the ovaries are mobile and accessible, or are they fixed. Because there are some pelvic pathologies like endometriosis which produce these fixed ovaries and further obliterate the tubal ovarian relationship, and these are responsible for the fertility infertility issues in a good number of cases. And then after we look at the ovaries and the mobility of them, we would want to look at the pouch of Douglas also for the same thing. We are looking for adhesions, etc. Then after we look at this, it's about then we go to the male partner. In male partner, one basic test that we do routinely in our OP is a sperm analysis. That is a semen analysis. Here, there are a few factors that are looked into, starting with the volume, then coming to the count, and then coming to the motility and normal forms. These are the four things that we look into. When we ask for a semen analysis, each center has their own way of doing it, and fertility centers more so do it with a certain amount of abstinence, what we call gap from the last intercourse. With 3 to 5 days of gap, we do it. And starting with volume, whether the person is producing high volume of it or low volume, and then the count, motility, and the percentage of normal morphological sperms, each one of these have a bearing on the understanding of where lies the pathology. Somebody with low volume could have had spillage, could have had some other obstructive conditions. All these things, every step of them are important and need to be well understood by a clinician to help the couple better. So, like we have multiple panel of tests in the women, in men the basic test is this. And if we see abnormalities in the semen analysis, we would want to look at the hormonal profile of the man. And after the hormonal profile, there would be a general examination, which would be done by an andrologist, which would be very important to understand as to what goes into the problem picture of the male fertility issue here. And this could be required that there might be need for a Doppler. And apart from that, there are some chromosomal tests that are done, like karyotyping, Y chromosomal microdeletion, etc. These are done only in specific conditions and as and when required. So, with all these done systematically, we come to understanding as to where lies the problem. We have done a scan, we have seen a good number of follicles, but we see some sausage shaped structures on either side. That means there is some pathology in the adnexa. Maybe a tube has gotten swollen, etc. Or when we do the scan, we see big fibroid staring at your face in the uterus. So, or there is a cervical fibroid which is preventing entry of sperms. So, there is nothing like a systematic understanding and investigation which is done, which helps you understand where the problem is. So, once we look into a good ultrasound, and if required, a tubal patency test, which is called HSG hysterosalpingography, which will evaluate the tubes. And we have also looked into the general peritoneal factors through your ultrasound scan. And in certain cases, when there is any query and there are high suspicion, you might even need to add something called a laparoscopy to confirm your findings, which you have noted on the scan. So these are the various investigations which we have in your armamentarium. And apart from these, there are advanced tests that can be done, but these are only reserved as and when they are required. So once you get all these tests done, you understand. So there is scan done and you understand the egg number is good, the uterine cavity is good. And then you have the sperm analysis, which shows normozoospermia with a good number of sperms, the number and quality, motility, everything being good. And then the woman comes to you with history of 1 to 2 years of infertility issues. You can start with some basic treatment, as in you can just advise her about what is the fertile period and how exactly a pregnancy happens, and give them a little boost up and understanding as to how we can help this scenario out. And some simple treatment modalities like ovulation induction with a few oral tablets could be sufficient. And this is what we called as the ovulation induction and timed intercourse. This is the basic form of treatment. Somebody who has some motility issues or the sperm number is less with 2 to 3 years of marital life, or sometimes around 5 years, previously had no treatment at all, you can think about next step of treatment, which is the IUI, that is the intrauterine insemination, wherein instead of the couple having relations on their own around the time of ovulation, this man gives his semen sample, and that is taken into the lab and is prepared and processed into a better quality sample, and that is directly injected into the uterus, and thereby preventing the travel of the sperm from the cervix into the uterine cavity. That distance is reduced, and sperm can move directly from the uterine cavity to both the fallopian tubes, and thereby increase the chances of fertility. This is an IUI cycle. After this, the next advanced level of treatment, that is the IVF and ICSI, which is reserved only for certain cases where there is indication, as in very low number of sperm count, or the woman has very low ovarian reserve, as in the egg number is very less, or somebody with a very advanced stage who have more chances of having genetic abnormalities, wherein we would need pre-implantation genetic testing to be done. In these cases, we would want to do an IVF or ICSI. In IVF or ICSI, what generally happens is, instead of the natural cycle where there is only 1 or 2 eggs which grow, we give injections from the period day 1 to around 10 to 12 days after periods, and then multiple eggs grow, and these eggs are transvaginally aspirated, and these are done ICSI upon, as in the sperm sample from the husband is taken, and the better quality sperms are selected from there, and each egg is directly injected with the sperm under the guidance of a embryologist who does this procedure. It's called ICSI, and this further on are taken care and are incubated, and you look at them after 3 or 5 days to understand how the embryos are forming. And this is what people famously call as test tube baby, but in technical terms, it is nothing but IVF or ICSI. These are the three treatment modalities that are available, and there are furthermore advances in these treatments, like we can add upon something called PGTA, which is genetic testing of the embryos to understand if there are any genetic abnormalities. And in certain women, when there are, in certain men, when there are problems like azoospermia, wherein there is absolutely no sperm which is noted in the semen that is produced, We might need to do certain additional surgical procedures like TISA, that is testicular sperm aspiration, to get the sperm out of the testis itself. These are few other advances available with us. If you have any questions to discuss and understand any more about fertility queries, you can always ask us in the chat or reach out to us at Apollo Fertility. Thank you for your patient hearing. Hope your questions have been resolved.